Hello and welcome to ADAA's webinar, Anxiously Aging, Understanding and Living Well with Anxiety in Late Life. My name is Jolie Busby and I'm the Education and Training Manager here at ADAA. I am very pleased to introduce our presenter, Dr. Julie Erickson. Dr. Erickson is a clinical psychologist in private practice, an adjunct faculty member in the Department of Applied Psychology and Human Development at the University of Toronto in Toronto, Canada. Dr. Erickson works with adults across the lifespan to overcome anxiety and other life challenges through evidence-based psychological interventions. She seeks to transform our ideas about aging and improve the standard of care provided to older adults through public education and workshops for mental health care professionals. She is the co-author of the Aging Well Workbook for Anxiety and Depression. Welcome, Dr. Erickson. Thank you so much for talking with us today.
Thank you so much for having me. I'm going to get my slides configured here and then we'll be off to the races. All right. Well, hello, everyone. Thank you for tuning in today. I'm really looking forward to spending the next 30 minutes or so talking and giving you a bit of a primer on anxiety in later life. So we'll talk today about when anxiety is normal or maybe even healthy in late life and when it might become problematic, as well as a variety of different things that you can do as an older adult or maybe someone supporting an older adult to help better manage anxiety at this stage in life. So Jolie did provide a very nice introduction for me and just to add a few more details about myself. So I'm a clinical psychologist in private practice in Toronto. Now I work with adults across the lifespan, but have a particular interest in working with older adults as they deal with a wide variety of different challenges, anxiety included. I also am an adjunct faculty member in the Department of Applied Psychology and Human Development at the University of Toronto, where I teach a graduate course on cognitive behavioral therapy. And finally, I'm also the co-author of a book that was released last fall called the Aging Well Workbook for Anxiety and Depression, which is a great evidence-based self-help resource for older adults who are looking to take some steps to better manage their mental health in late life. So if you're looking for a good resource, please keep this book in mind. Now, as a brief disclaimer for the presentation today, although I'm a clinical psychologist who does therapy with older adults, today's presentation is for informational purposes only. And if you're wanting to do additional work to understand your mental health needs a little bit more, please consult with a medical or mental health professional and even consider using one of ADA's great resources, the Find Your Therapist directory, to do that. So in today's presentation, I'm going to be trying to answer 4 questions. The first question being, what is normal anxiety? And what are the ways in which it might actually be helpful to older adults? And when might it be considered a problem? When might anxiety start to verge into an anxiety disorder? Second, I'm going to attempt to answer, how does anxiety differ for older adults, if at all? So is it experienced differently by older adults, or are there unique aspects to it in later life? I'm going to attempt to shed some light on that. Next, I'm going to talk about who is at risk of an anxiety disorder in late life. But not only that, what are some of the protective factors, things that might reduce your risk of developing an anxiety disorder in later life? And then finally, turn to talk about management strategies. So how do older adults best manage their anxiety at this time of life? And what are some of the things we know from research that tend to be helpful for older adults? So let's start first with first question. So what exactly is anxiety? This word gets tossed around quite a bit, and sometimes without a clear definition of what this actually means. So to help answer this question, I'd like you to imagine for a moment that you're in your doctor's office at your most recent physical exam or checkup. Now, your doctor has done some blood work and other tests and tells you that, well, if we find anything worrisome, we'll give you a call. Well, it's 2 days later, and you get a voicemail from your doctor's office asking you to give them a call back as soon as possible. Now, what would your reaction to this be? What would be going through your head at the time? What do you think you'd be feeling emotionally? Would you notice any physical sensations come as you're thinking or feeling this? Now, some people may have thoughts such as, uh-oh, what could this mean? Do I have something serious? Am I going to get terrible news? They may start to feel nervous or apprehensive. Their heart rate might pick up, and they might rush at the chance to call their doctor back. So all the reactions described here really encapsulate what anxiety is. And simply put, anxiety is like a fire alarm that alerts us to the possibility of danger or risk. But the operative word here is possible. Anxiety speculates what bad things might happen in the future when we're in the face of some kind of perceived uncertainty. Now, why, you might ask, would we have evolved to have this speculative fire alarms in our heads? Well, it's actually, in fact, a huge advantage to be able to anticipate possible dangers or risks that might happen in the future so that we might be able to take actions to ensure our safety and well-being. So it's no overstatement to say that anxiety can be a lifesaver. Now let's look in a little more detail what actually is involved in anxiety's alarm system and how its various components work together to help keep us safe. So let's first look at thoughts, as anxiety tends to trigger certain types of thoughts. It can first bring to mind a lot of worst case scenarios, even if it's not clear that we're in danger. So for example, if you don't get a call back from or a text back from your daughter that she got home safely in a snowstorm, your thoughts might go to, well, what if she got into a car accident? Now, anxiety can also trigger different types of thoughts. Our anxiety can also make us consider how we might prevent or cope with some type of future event. So if I'm worried about being able to find my new cardiologist's office, I might think about calling to ask for directions. So in many ways, anxiety can nudge our thoughts in a direction that can be adaptive. Now, in terms of emotions involved here, now anxiety is technically an emotion, but there are other ways to describe it. Sometimes people talk about feeling nervous or apprehensive or uneasy, right? That can be a part of this response. Physically, there are some components to anxiety as well. When we feel anxious, this corresponds to an increase in two different stress hormones in our bodies, adrenaline and cortisol. And these two stress hormones cause a cascade of different physical reactions in our bodies, such as restlessness, muscle tension, increased alertness, sometimes upset stomach, and even things like changes in breathing or heart rate. All of these changes represent our body's best efforts to get us ready to flee a situation that's dangerous, fight the threat that's in front of us, or freeze. So hence, this physical response is called the fight, flight, freeze response. And then behaviorally, anxiety can nudge us to do any number of different things. It may make us want to avoid situations that might seem risky. So if you've been told that it's too risky for you to continue driving because of declines in your eyesight, you're going to avoid driving, and that's likely in your best interest. Alternatively, anxiety can also activate us to take action to prevent or mitigate risks. This is the very reason, we buy trip cancellation insurance, right? If you're traveling somewhere, let's say during hurricane season, or you might change your diet because you've been told that you're at high risk of diabetes or heart disease. And then finally, anxiety can also make us freeze, so-called panic paralysis. So it can stop us in our tracks. If you've ever been on a hike and encounter wildlife of some sort, your instinct might be to stop and observe. And believe it or not, other animals have this reaction too when they face perceived threats. They might play dead to protect them from predation. So when we look at it, anxiety's alarm system is actually a very well-coordinated response. And quite simply put, the bottom line here is that anxiety is a nudge to deal with future problems today. And there's many ways in which this response comes in handy, right? Anticipating risks can help us find solutions, mitigate risks, or help keep ourselves safe. Anxiety can also be information to us that we're doing something new or doing something challenging. So it doesn't necessarily have to mean that something bad is happening. It could also mean that we're doing something that's outside our comfort zone. So the question here becomes, all right, so if a lot of anxiety ends up being healthy or adaptive or important or protective, when does it become disordered? Well, anxiety can become like the smoke alarm that goes off when you've burnt toast at home. So the alarm is doing everything it's supposed to be doing. It's just picking up on a danger that isn't so dangerous, or it's going off more so than it should. And maybe it starts to interfere with other important things in your life. So anxiety can become disordered when it's disproportionate to the situation. So if you're worrying that a headache is a brain tumor when you have a clean bill of health. Secondly, when anxiety occurs more often than not. So if you are worrying about anything and everything, and it's taking up most of your time in a given day, this is when anxiety starts to become more problematic. And finally, when anxiety starts to interfere with important aspects of your life. So if you're spending a lot of time preoccupied with your own worries, such that you stop doing valuable things that are important to you, your hobbies or engaging in relationships, then it can become problematic. Now, there are many different types of anxiety disorders out there. And although we won't go into a lot of detail about each one of these different disorders, I'll put them on your radar in the event that you might be undergoing additional investigation for one of these anxiety disorders. One of the more common anxiety disorders in later life is generalized anxiety disorder, which involves worrying about a variety of different things, whether that's the well-being of your loved ones or worrying about bad things happening to you or other people, worrying about mistakes, worrying about your finances, right? It's sort of worrying about most things. Then we have social anxiety disorder, which is worrying about being negatively evaluated or judged by other people. So worries primarily restricted to social situations. Then we have illness anxiety disorder, where someone might be worrying more often than not about having or developing a serious illness, like cancer or dementia, despite maybe not having signs of that disorder or disease. And then we have panic disorder, which is about having frequent acute episodes of intense anxiety, debilitating panic attacks. And then we have phobias, which are heightened anxiety and avoidance of particular situations like enclosed spaces or heights or spiders or driving. So these are a number of different disorders that can emerge in later life or across the lifespan. So now let's turn to answer the question, how does anxiety differ for older adults? So I'll highlight here things like, is anxiety less common for older adults? Are the symptoms different? Do people worry about different things as they grow older? So first, I'll highlight one way in which late life anxiety can differ. So in general, anxiety disorders can become less prevalent as people get older. So in particular, we see the prevalence of things like social anxiety or panic disorder start to decrease in how common they are in late life. And this is consistent with a broader trend we see suggesting that mental health can improve in later life, with people generally getting happier, a little more emotionally stable, or more content. However, other anxiety disorders like generalized anxiety can still remain prevalent. So it's estimated anywhere between 10 to 28% of older adults experiencing generalized anxiety disorder. So although some disorders become less common, some remain fairly stable, and for some can even increase. Now, secondly, late life anxiety can differ in that it might be mistaken for other conditions or under-recognized at this time in life. So, because the symptoms of anxiety disorder can overlap with other medical conditions, so things like fatigue or agitation or difficulty sleeping, right, can both be symptomatic of an anxiety disorder or another medical condition. And because older adults are experiencing a higher volume of medical issues, sometimes this can lead to an anxiety disorder being misdiagnosed as a medical condition, or vice versa, a medical condition being chalked up to anxiety. And furthermore, anxiety disorders can and do go under-recognized in later life due to older adults seeking help at lower rates, typically, than younger adults do. And older adults may not always be aware that what they're experiencing is symptomatic of an anxiety disorder. So again, they can go underdetected and undertreated, unfortunately, as a result. Now, another way late life anxiety can differ is that the types of things that people worry about can shift. So, older adults may tend to worry about things like their health or their relationships with family members versus, let's say, building a career or finding and maintaining a romantic relationship or parenting or child rearing. So, this merely reflects, right? People are at a different developmental stage where there are different types of things that are cause for worry. Next, late life anxiety can differ in terms of some of the symptoms that older adults report. Now, there's some research to suggest that older adults may present with more physical symptoms of anxiety than, let's say, younger adults. So when they go to their general practitioner, they might talk about how they're feeling wound up or restless or tense, or they're having difficulty sleeping, as opposed to talking about the cognitive aspects of anxiety. I'm worrying a lot. I'm having a hard time concentrating or making decisions. Now, although this isn't the case for everybody, there's certainly some older adults who may experience anxiety in the cognitive ways as well as the physical ways. There's some evidence to suggest that some older adults may be presenting and talking more about the physical symptoms as opposed to some of the others. And the final way that I'll highlight here that late life anxiety can differ has to do with what's going on in aging brains. And aging brains can become less efficient at regulating anxiety. So, the parts of our brain that are essentially the gas and the brakes of anxiety are called the amygdala and our prefrontal cortex. And as people age, the gas and the brakes aren't communicating as efficiently as they used to. But the good news is that successful treatment of anxiety in later life can help reverse these changes, can help make the gas and the brakes work more smoothly and together. All right, so with that in mind, let's now turn to look at both risk and protective factors of anxiety in later life. So we'll start first by looking at who might be at higher risk of an anxiety disorder in late life. So from the empirical research, we know that first and foremost, there are different socio-demographic features that might place an older adult at higher risk of developing an anxiety disorder. So we know that being female, being single, right, including those who are divorced or widowed, being childless, and being of low income does increase one's risk for developing anxiety disorder in late life. And although these things aren't causally related, being female doesn't cause an anxiety disorder in late life, a combination of these factors, right, might interact to increase someone's risk for developing an anxiety disorder in late life. We also know that if you've been diagnosed with some form of cognitive impairment, such as Alzheimer's disease or another type of dementia, that you are at increased risk of anxiety. Thirdly, we know that having a chronic health condition increases your risk of an anxiety disorder. So if we think about things like diabetes, heart disease, renal disease, or COPD, you can probably anticipate how all of these things would create additional stress and challenges in coping. It's a lot of work, right, to manage a chronic health condition. And the nature of these conditions can be unpredictable and uncertain, right? So can be a recipe to feel quite anxious and overwhelmed. And the other risk factor I'll flag here is having functional limitations. So if you have limited mobility, for example, or impaired vision or hearing, all of these conditions pose difficulties in how you navigate your day-to-day life. I think of a former client of mine who had a condition that resulted in progressive blindness. And this created a lot of stress for this individual about just being able to complete daily tasks like getting on the right subway, right, or responding to the correct email. So collectively, all these functional limitations can be quite stressful and increase risk of anxiety disorders. The other factor that I didn't raise here, but I think is important to raise, is having a history of traumatic events. So if you're someone in your lifetime who's experienced different types of trauma, so whether that's a bad accident or injury or experienced abuse or other types of traumatic events, that in late life also increases your risk for anxiety. But it's not all bad news. So let's look now at some of the things that tend to protect older adults against anxiety disorders. So first I'll flag social support. So we know that feeling like you have access to meaningful social connections and supports is hugely beneficial and protective against a wide variety of both mental and physical health conditions in late life. And this doesn't have to mean that you have a packed social calendar or a large social network, right? And that you're socializing every single day. But even just having 1 to 2 people in your life who you feel like you can be yourself with and who you feel like you can be vulnerable with and who would be there to help you if you needed it is protective, right? So you don't have to think big here. It can be small. Physical activity. So physical activity or exercise has got to be the universal protective factor for a lot of different things. And particularly when we talk about different types of mental disorders or anxiety. So what we know, even 20 minutes of walking per day has been shown to have beneficial impacts for mental health. And for older adults, aerobic exercise in particular has been shown to be beneficial in reducing risk for anxiety disorders. Cognitive stimulation. So there's been some interesting longitudinal research looking at cognitive stimulation at various different points in the lifespan and linking higher levels of cognitive engagement to reduce risk of both anxiety and depression in later life. So whether this is reading, playing bridge, learning a new language, taking a dance class, or the like, we know that staying engaged, using the horsepower between the ears, so to speak, is protective for anxiety in later life. And finally, coping skills. So having healthy coping skills that you use to deal with the stressors of later life is really important. So maybe you're an excellent problem solver. Maybe you seek, social support and have a great, family system. Maybe use meditation or exercise, or you're involved in your religious community. All of these can be ways that we cope with the challenges and issues that emerge in later life. So the good news here is that elevated anxiety doesn't have to be a normal or inevitable part of aging, and there are many effective ways to manage it. So if you are someone who's struggling right now with anxiety, it's a great time to be struggling with it, and because we know a lot about what can be effective for managing anxiety when you're an older adult. So let's answer this question next. What can older adults do to better manage their anxiety? So I've separated sort of three buckets of things to consider if you're trying to better manage your anxiety in later life. So given what I've mentioned about sort of physical activity, certainly exercise is one of the things you can do now, right, to get a better handle on your anxiety. And I'm a big fan of thinking small as opposed to thinking big and being overambitious. So especially if you're someone who has, let's say, struggles with mobility, or you've got, other functional impairments or issues, think small when it comes to physical activity, whether it's things you can do while you're sitting down or shorter forms of physical exercise. It all has the potential to be beneficial. So physical activity is a great way to be better managing your anxiety in later life. And given what we know about, the burden of chronic or acute physical health issues, treating physical illness, right, and doing so as soon as you can is a way to get ahead of and reduce risk of that impacting your mental health for the worse. And medication treatment options. So there are a number of really effective, safe medication treatment options for anxiety in later life. And this is a great option to consider if you're someone who has more severe heightened levels of anxiety in later life. That might be a great first line option to consider before trying things like therapy or other management options. Now, secondly, I did highlight, the protective nature of social support in managing anxiety in later life. And so if you're looking to take a look at and further deepen or use your social support systems to better manage anxiety, there's a few aspects of it to consider. So the first piece has to do with social participation. So think a little bit about, to what extent am I participating in and engaged socially in my day-to-day life? Some older adults struggle in terms of being more isolated or not having access to, let's say, a community where they do feel like they can really participate and be engaged. So that's one aspect to consider. The second aspect is a feeling of belonging. So in addition to being engaged, it's also really helpful to have a sense of I belong somewhere, right? I'm part of a community, I'm part of a group, right? Whether that's an exercise class that you go to each week, or a church or religious organization that you belong to, or a volunteer organization you show up to, having a sense of belonging is really important for all of us. And then social support. And so by this, I mean, do I have people that I can share my innermost feelings with? And do I have people who I can rely on if I were to need help of some sort from them? So reflecting a bit on, how you get each of these social needs met is important, and considering beefing up, right? Or considering other options for how to increase your participation, belonging, or support are beneficial. And then finally, we have a number of excellent evidence-based psychological treatments that are effective for treating anxiety in later life. Now, this isn't an exhaustive list here, but the few that I'll highlight that certainly are very promising and considered, gold standard of treatment for anxiety in later life includes cognitive behavioral therapy or CBT, mindfulness meditation, and acceptance and commitment therapy. So sometimes it can be overwhelming to figure out, what type of therapy is right for me. But these are three to consider as good options where we've got evidence to suggest that they're effective for older adults and just as effective in late life as it might be for younger people. Now, because I am a CBT therapist, I want to leave you today with a sneak peek of what to expect if you're doing cognitive behavioral therapy for managing anxiety in later life. Sometimes knowing what to expect in these types of therapies can help you take the leap to actually doing it, right? Connecting with a treatment provider to help you learn some new skills to manage your anxiety. So in CBT for anxiety, first and foremost, we're hoping to increase awareness of the interconnection between thoughts, behaviors, emotions, and physical sensations. So you heard me talk today about how anxiety comes with fairly predictable patterns, right? And how we think, how we behave, how we feel, and what we experience physically. And in CBT, we really want to help people start to recognize and have greater awareness of what their own thoughts, feelings, behaviors, and physical sensations are. And with that increased awareness, one of the things we hope to do is to recognize and challenge unhelpful thinking patterns. So anxiety tends to make us overpredict negative outcomes. And it's doing its best, right, to help keep us safe. But what that means is that, again, it becomes like the smoke alarm that goes off when you burn toast. It tends to overpredict how terrible things are going to be, and it makes us underestimate our abilities to cope. So in CBT, we really want to highlight and be able to pick up on when anxiety is making us think in a way that's a bit extreme or distorted, and knowing how to recalibrate our thinking and helping ourselves think in a more realistic and helpful way about the challenges that we face. Now, another important part of CBT is learning to face our fears. So oftentimes when people feel anxious, there's a tendency to want to avoid or put off and not face the things that are really worrisome or triggering for us. And we also might engage in what we call safety behaviors, which I would call maybe excessive overdoing of things, over checking, over preparing, over researching, or seeking a lot of reassurance from other people. And although avoidance and safety behaviors are playing some type of function and purpose for people and managing their anxiety, they're also things that tend to make anxiety worse over time. So in CBT, we're working at helping people get better at facing their fears without engaging in excessive forms of overdoing things, underdoing things. And what's also involved in CBT for anxiety is learning to modulate some of the physical symptoms of anxiety through something called relaxation training. And this is a particularly effective intervention for older adults. Um, if you're someone who experiences a lot of muscle tension, right, or you really feel your heart rate picking up, or you're having difficulty sleeping at night because you're so revved up, then relaxation training can be a really effective way to help feel like you've got a little bit more control over what's going on inside your body. And although we can't flip a switch and turn off those physical sensations, immediately, relaxation training is a way to help feel like you are, yeah, modulating the intensity and helping yourself start to relax and learn how to do that. And the ultimate goal in CBT for anxiety here is to learn to live with uncertainty and without trying to over control it. Uncertainty can be hugely destabilizing for many of us, and later life is filled with lots of different types of things we can't control, or new challenges, various different types of uncertainty. And we have a choice when we face that uncertainty. We can launch into our best efforts to over control those things. Or, we can learn to accept, that there will be things we won't know. And we can try to exert our best efforts to engage in effective problem solving, um, try to be in the present, right, as much as we can, and not over rely on worry, right, to try to predict the future. So that's the ultimate goal of CBT for anxiety. So with that in mind, I know that's just a brief overview, but if you have any burning questions that you'd like to ask me, or you'd like more information about the topics covered today, you're more than welcome to email me, or be in touch through my website here. And I'd like to thank ADAA for hosting today's webinar, and I'll turn it back over to you, Jolie.
Thank you so much, Dr. Erickson. We appreciate your expertise on this topic and appreciate you taking the time to share such helpful information with our audience. Thank you again for today. So here we go. A little bit about ADAA. The Anxiety and Depression Association of America works to prevent, treat, and cure anxiety disorders and depression through the alignment of science, treatment, and education. We invite you to explore our website at adaa.org, where you can find resources such as our Find Your Therapist directory, free evidence-based webinars, blogs, and videos, our free online peer-to-peer communities, self-help books and publications, and also we ask you to consider subscribing to our free monthly e-newsletter, Triumph. So on behalf of ADAA and our presenter, Dr. Julie Erickson, we thank you for joining us today. We'll see you next time.